I'm Arielle. I'm one of the level 1 student nurses. Do you mind if I follow you around today?
Oh, no, that's fine.
And do you have a patient to see?
I do.
Okay. Do you mind giving me the S bar room?
It's no problem.
Thank you.
Okay, so in room 231 we have a Mrs. O'Connor. She's 34 years old and she's an African American female with an allergy to sulfa drugs, namely trimethoprim sulfamethoxazole. And she's a full code. She actually was admitted for a fever as her primary concern, as well as end-stage renal disease. And she came in at 5:30 with complaints of fever, chills, and just overall malaise. She has a history of type 1 diabetes, and she reported elevated glucose readings and also decreased appetite for the past few days. And then she also has minimal urine output over the last month. So she's had a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She's been getting dialysis every 3 times a week for the past year lately, and she's actually been on the transplant list for about 6 months now. Right now, she's reporting her pain at a 4. It's just a generalized aching pain, nothing in a specific area or anything like that. She's awake and alert times 3. She's very cooperative, and she's Perla. She is a fall risk. English is her first language, and she's reporting numbness and tingling in both of her lower extremities. She has full range of motion in all extremities. Right now, her lungs are clear to auscultation, but she has mentioned having a cough. And it is a productive cough with just a little clear excretions, but it's a cough nonetheless. She has good skin turgor. Her chest expansion is normal. She's not on any oxygen. She is tachycardic right now. Her last vitals show that her temperature is at 101. Heart rate's at 95. So she was tachycardic. It looks like it's coming down now. She's at 96% oxygen, and her blood pressure is 138/78. So that's a little high. She has a regular rhythm in her heart. She has S1 and S2 present. No murmurs are present. Her femoral pulses are 2+. Her pedals are 1+ in both lower extremities, so that's a little unusual. She has non-pitting edema in both of her lower extremities. And her cap refill in both her lower extremities is more than 3 seconds. And so her abdomen right now is flat and non-tender. She had a bowel movement yesterday, and she has bowel sounds in all 4 quadrants. She's on a renal diet with a 1,500 milliliter restriction, fluid restriction. Her appetite has not been bad. She's eaten about 75% of her breakfast this morning. Of course, we've only had her since about 5:30, so we haven't had a whole lot of time to see how she's doing, but thus far she's eating. She has been having some trouble voiding lately, and her urine right now is amber-colored and it's cloudy, so that's kind of unusual. She might need a Foley if she's not able to void on her own, and given that we've had her for about 2 hours, we have had her on strict intake and output, and so far she has had, I think, 375 milliliters intake, but then only 200 output. But again, that's only been 2 hours, so we'll see if that changes after that. So far, she has orders for medication-wise clonidine, Impenem, Cilastatin. Impenem Cilastatin is one medication. 0.9% normal saline, and then acetaminophen as needed. And in her doctor's orders, these didn't actually come up, but I called and verified with the doctor. We are supposed to give her these medications, even though they're not showing up in the provider's order. They are inside the MAR. And we'll actually be giving her Impenem Cilastatin and the normal saline through an IV today. In her right forearm, she has an IV established, and in her left forearm, she has an AV graft for dialysis. She's been getting that. So, things that are going on today. She had a chest x-ray that came back normal. She has a urine culture pending. She has blood drawn for tests. Waiting on dialysis today. After she gets dialysis, she's supposed to be put on IV Epicone. And her urinalysis actually show more white blood cells than normal are supposed to be in her urine. Like the normal levels are 0 through 4. She actually had 15. So that's kind of weird. And then she also had white blood cell casts in her urine. So I'm thinking there might be some infection in there. And then given the fact that she's coughing and having secretion, she could have a lower respiratory infection also. So that's the probable reason we're giving her Impinim and Celastatin. Oh, and her doctor's name is Engelbert, if we need to contact him. Okay, so that's about everything. I'm going to say that's everything.
Can I ask you a couple of questions?
Mm-hmm.
So why specifically is the client receiving this medication?
I just scared myself with my... So, given the fact that she has a fever and increased white blood cells and white blood cell counts in her urine, and the fact that she's coughing, we're thinking she probably does have an infection. So we want to give her some kind of anti-infectant or something that can kind of help her get over the infection, basically.
And what action does this medication have on the body?
Impimin and Celastatin actually, it binds to the bacterial wall during like a really key phase of bacterial synthesis, and it kills the bacteria in that way. And then Celastatin actually, I believe it prevents kidney excretion of the drug, so it keeps the drug in the system a little bit longer so that it can take full effect.
And when should you question administering this medication?
If the patient has an allergy or hypersensitivity to the drug, you wouldn't give it to them. And then if they have a cross-sensitivity to penicillins or cephalosporin, so if they're allergic to either of those two, you might want to rethink giving them the drug.
And does the medication have a therapeutic serum level?
I don't believe it does, no.
Okay. And which vital signs must be monitored?
You kind of want to monitor the BUN and creatinine. You want to make sure that if those levels start to rise, you have to wonder, is like the kidney function starting to become compromised? And if that happens, drug's going to stay in the system longer, so you want to be careful about that, be monitoring that. You also want to kind of be watching for anaphylaxis, because I believe this is probably the first time the patient's receiving this medication, so they may not respond well to it. So you want to watch for like a rash or difficulty breathing or tachycardia, just signs of anaphylaxis.
Okay. And which physiological parameters should be monitored when the medication is being administered?
Well, again, heart rate, kidney function, things along those lines, pretty much.
Okay. And what interventions must be taught to the client to ensure that the medication is safely administered in the hospital setting?
The patient should probably know the signs and symptoms of anaphylaxis. If they feel like they are having a really bad reaction to the medication, they need to hit that call light immediately.
Okay.
And then also, because it's an IV medication, you want to make sure that you ensure that the IV site is patent. So if they're having any kind of pain at the IV site, if it's red or swollen or anything like that, you want to make sure that they hit the call light.
And then what about the interventions that must be taught for taking the medication safely at home?
If the patient does have this medication taken at home, more than likely, I would imagine a home health nurse would be there to assist with it. But again, you want to make sure that they know about phlebitis, the signs and symptoms of anaphylaxis. Yeah, pretty much.
Okay. And then I know you mentioned a couple side effects, but are there any other possible adverse reactions that you should watch out for?
I mean, you kind of want to watch, like I mentioned anaphylaxis, we won't go over that again, but super infections, like this is an IV antibiotic, so it may go in and mess with the way that the bacteria flora exists inside of the intestines and everything, and that can cause other bacteria to come in and just overgrow and like chill in that general area. And one example is Clostridium difficile. Sometimes that happens, so the patient may get a CDAD infection, Clostridium difficile associated diarrhea. Or other things that can happen are thrush. It can mess with like the way that the normal saliva production takes place in the mouth, and then you can have bacteria like, I think it's called Candida, come in and just overtake that area too.
And then how will you know the medication is effective?
Well, we're going to be watching her temperature, we'll be watching her cough, we'll be monitoring her overall urine status, because like I said, it was dark and cloudy, so that's not totally normal. I mean, the dark is because her kidneys aren't functioning that great, but it's cloudy because there's probably an infection in there, so we'll be monitoring that to see if that clears up. We'll be watching to see if the white blood cell count in the urine decreases, and when we get the blood test back, we'll know more too.
Okay. That's all the questions I have for right now.
Okay, I guess let's go in and visit the patient, right?
Come in.
Ooh. Hi, Mrs. O'Connor. My name is Brittany. I'm going to be your nurse today. And then I have student nurse Arielle with me as well.
Hello.
Hello.
So we're here to actually give you some medication and set up an IV line. Could you give me your name and date of birth?
It's Shanae O'Connor, 34 years old.
These bids always trick me. So you said Shanae O'Connor, 30. What? How old did you say you were?
34?
Okay, that matches up. I did the book at the same time. We'll say I raised the bed.
Okay, that's fine.
Okay. So I'm going to go ahead and wash my hands. Okay, I'm going to go ahead and check the medication. Again, it won't be listed in the provider's orders, but I called the doctor ahead of time. He meant to put that in the provider's orders. I'm going to check it in the market just to make sure that we're supposed to get this medication. Okay, I believe the doctor ordered Imponem, Celastatin. It's an IV injection. It was ordered at 6:30. And it is supposed to be 500 milligrams IV per year. And it's supposed to be every 8 hours. So we're going to give one set of 8 hours. And then also normal saline at 6:30, 30 milliliters an hour. It's supposed to be a continuous infusion. Really fast. I'm going to check her IV line. Do you have any known allergies?
I'm allergic to sulfa drugs.
Sulfa drugs. Okay, let me check. Yep. Specifically, trimethoprim, sulfamethoxazole. So let's take a look, make sure that that's in there. Drug allergies. Trimethoprim, sulfamethoxazole. So matches up with what's in the MAR and just on the general patient thing. I touched my laptop, now I have to review this real quick. Are you having any pain or anything?
Nope, I'm doing good.
Does your IV site feel okay?
Yep.
Sounds like your neighbor's having fun with their bed, too. Just one, please. Just the one, please. Okay. You know, it's funny, I had some antiseptic wipes. They seem to be gone, so I'm going to have to go get some more. Well, sometimes I don't think they're going to be in my pocket, though. Okay, student nurse Ariel is going to go grab one for me real quick.
Okay.
The last thing on earth I would want to do is not perform a aseptic technique in an area that's sterile. Have you ever had Imponem Celastatin before?
I'm not sure.
You're not sure? Okay.
I've had antibiotics, but this one should be okay.
Thank you, student nurse. You're welcome. Okay, I'm going to go ahead and clean her IV site. Normally you clean this for about 15 seconds. Okay. Now I'm going to go ahead and flush it. Alright, tell me if you're feeling any kind of pain or discomfort.
Okay.
Okay, does it feel alright?
Ow. Just kidding.
You just don't go do that. Okay, it seems like the IV site is good. Okay, before I do this, I'm gonna go ahead and deglove real quick. Yeah, I'm gonna leave it here because I don't want to dump gloves. Okay, I'm gonna go ahead and wash my hands before touching anything. Okay, because this is a newer drug I don't think that you may have had before. Has anybody ever talked to you about signs and symptoms of anaphylaxis before?
I know that's allergic reactions, like rash and itching. Is there anything else I need to know?
If you feel like you're having a hard time breathing, and like you said, rash and itching, and if your face swells or if your mouth is swelling, like your tongue, blocking your airway, anything like that, be sure you hit your call button.
Okay.
Okay? Okay. I'm gonna put this down real quick. So, I'm gonna double check. Normal saline. So this looks pretty decent. It's clear. I'm not seeing any particles floating in it or anything like that. It has not expired. And it is 0.9% saline, which is what's ordered. And it was ordered at 6:30. Right now it's 7:30, so we're within the time frame. It's supposed to be 30 milliliters an hour, continuous infusion. And then let me verify your name and date of birth one more time.
It's Shanae O'Connor, 34 years old.
Okay. And that's what's listed here. Okay. So I'm going to go ahead and get this going. Okay. I made a farting sound with my voice. We're going to take that off. A little tight up over here. Sometimes they're all crazy like that. Cap is on there, cap is on here. I'm going to go ahead and take this off. This point is sterile, so I'm not going to touch that. And same with this. See, sometimes it does that. It just wants to kind of shoot liquid everywhere. I'm going to go ahead and make sure we're clamped, because the last thing I want is fluid running everywhere, which it is. I'm going to fill the chamber about 2/3 of the way. Stay. Okay. Alright, I'm going to run it. Alright, and I'm clamping nice and slow so that we can prime the tube and make sure that no bubbles get in here or anything like that. Which I'm not seeing any bubbles. See that primed nice and fast. Say that again?
It's dripping.
Yeah, which is a good sign. And then as you can see, if you want to come over here and look, you prime it slow so that you make sure no air bubbles get inside the tube, because the last thing you would want is to have air bubbles get inside the tube. And then if it just happens to touch your scrubs, you just want to make sure it stays sterile. Okay, so I've got it clamped. I'm going to go ahead and recap it. I'm just going to set this here for a moment. Okay, I'm going to check one more time. It's supposed to be started at 6:30, 30 milliliters an hour. It is sodium chloride, 0.9% normal saline, which is right. And her name and date of birth is correct. Okay, so I think this is okay to start. Although, I am first going to go ahead and swab the patient's thing. You want to tell me your name and date of birth one more time?
Shanae O'Connor, 34 years old.
Okay, that's right. That's right. Can I go ahead and swab this for about 15 seconds? Okay. I'm going to also swab this real fast. So, swab this for the moment. And then I'm going to set this down for a sec. Really fast. I probably need to pass it on. Okay. So the way that the bar works, I have to put in your ID as well as the drug's ID really fast would you mind reading off the patient's ID?
Sure.
Nothing changed. Just. Okay, patient ID.
842
Mm-hmm.
33 43 660.
Okay, and then her medication. Not her medication, excuse me. You know, sometimes things go disappearing. Like, for example, the normal saline. Here we go. Okay, I'm going to put this in real quick. They make the letters so small on that. Okay. I got a green light verifying that this is in fact the right patient and this is the right medication. So that means I can go ahead and start the infusion with the relief of knowing at least the computer told me that this is in fact correct. So I'm gonna read it.
You're doing a great job.
Okay. So re-swap this. I'm going to go ahead and set this up with the patients. This is going here. Okay, so this is set up and we can start that. Okay.
And what is it running at again?
At this point, it is currently running at 30 milliliters an hour. That is what it says in the bar. Alright, now that I got that going, I'm going to go ahead and do the Impamine/Cilistatin. So remind me one more time your name and date of birth.
Janae O'Connor, 34 years old.
Okay, that matches. That's right. You're supposed to get this at 6:30. Right now it's 7:30. It's supposed to be 500 milligrams and 100 milliliters, running at, I believe, 1 hour. And then remind me what your allergies are.
Sulfa drugs.
Okay. Also matches up. And that's also in here. So yeah, 500 milligrams, 100 milliliters over 1 hour. It's supposed to be an IV piggyback, and you get it every 8 hours. So I'm going to look over this really fast. It's clean and clear. Almost said something else. Is not expired. It's 100 milliliters. And it does in fact say Impamine/Cilistatin injection IV piggyback. So this looks right. Checking it up with the MAR, which also looks correct. I'm gonna have a big pile of gloves after this. Okay. Distracted by the noises in the background.
Hospital is a noisy place.
They are noisy places, you're right. Okay, and then I verified in the drug book exactly how all these things are supposed to be given, whether they're supposed to be crushed or mixed or anything like that, so. Okay. Slightly different ones. Okay, gonna go ahead and alright, this little blue thingy, doohickey, thank you, okay, is for normal saline is supposed to hang lower than the actual piggyback infusion so that the piggyback infusion has more pressure to get through. Otherwise, you're literally just going to have normal saline running. So I'm going to put this up So that normal saline will be lower than the IV piggyback. Good to know. I have that up there. And then go ahead and pull out tubing. Make sure it is clamped, which it is. And then again, these 2 points are sterile, so I'm not going to let anything else touch it. This one didn't come squirting out at me. Wait, hang on a minute. Well, I'm going to swab it both real quick. Hang on. Just a minute. Okay. These 2 points are sterile, which means I'm going to keep that away from it. Okay. Okay. And it's clamped, so it's not going to go running out. I got to prime it real quick. I'm going to try to fill it up. Just a little past halfway. Okay, there are a few, if any, bubbles at all, so that looks okay. Alright, I'm going to leave this just right here because it's not running or anything like that. I'm going to check one more time. You can leave it. Sorry. I'll get it later. Okay, so name and date of birth one more time.
Shanana O'Connor, 34 years old.
Okay, do you have any allergies?
I have sulfa allergies,
Yes.
sulfa drugs.
Okay, that matches up with what you said. That's what's in the bar. Okay, I'm going to check the medication one more time. It's supposed to be Infamil, Cilistatin, given at 630, 500 milligrams, in 100 milliliters of an IV piggyback. That's supposed to run over 1 hour. And this, in fact, says Infamil, Cilistatin. So I'm going to go ahead and set it up. Well, hang on. Something is giving me a red flag real quick. And for some reason... Oh, I see. It's over here. Okay. Okay. I'm going to have you really fast read off the patient ID one more time.
Sure.
Just going to read off the band.
842
842
334
334.
3660.
Okay. And then I'm going to grab the drug. Put that in real quick. Okay, another green light. So that means it's okay for me to go ahead and give it according to the computer, because they are in fact receiving, or supposed to receive this medication.
Okay.
Okay. Don't please, just stay. Okay. I'm going to go ahead and attach this to the main line, but first I need to swab it. So I'm going to open this up really fast, pull this out, swab this, and then attach it. Okay, and then I have a dial flow, so I have to set that, because we said the drug is 100 milliliters in an hour, so I'm going to go ahead and set that flow at 100, as you can see right there. And then we can go ahead and unclamp everything. As you can see, this is now dripping at this point, and this is not. So this is what's running right now, and this is not. Okay. So do you remember the signs and symptoms I talked about?
Yeah, some allergic reactions, and if I would get what is it? Swollen face, swollen tongue, can't breathe. Then I will let you know.
Yeah. Okay, and then I'm going to go ahead and lower the bed, although it's probably going to act kind of crazy because it likes to do that. There we go. Okay, and then you have your call light over here. Is there anything else I can do?
No, that's all.
Okay. And then I actually have a little handout related to anaphylaxis and reactions that you can have on this drug. So I'm going to go ahead and leave this here for you. You can look over that. If you have any questions, you can press your call light.
All right.
Okay.
Thank you.
All right, thank you.
And then I just have two more questions.
Okay.
Were there any pertinent pieces of information that you reviewed before administering the client this medication?
I took note of the different signs and symptoms that the client was demonstrating. They had a fever, they had cloudy urine, they were coughing, so they had obvious signs that they were essentially having some kind of infection or fighting something. So that was that was one example of something that I reviewed before administering it.
Okay. And did this information affect your decision to administer the medication?
Because I would not have given it if they did not have those symptoms. Or, if they appeared healthy, there's no reason to give them any kind of medication. And sometimes the lights do that. We kind of just adapted to it here at the hospital of half hour the normal. See, they're back. What do you know?
Okay, and those are all the questions that I have. Thank you so much.
Okay, thank you.